All right, good afternoon. We're going to start now. My name is Merlin Chowkwanyun. I'm chairing this panel. Thank you for coming. I know after lunch is usually sometimes the plateau for energy, but I think these are very energizing talks, and I'm really excited to hear them. This is a panel on technological innovation and population health, and I think this is probably one of the most interesting times we could possibly be having a panel like this. There are dozens of examples of gadgetry in this room that didn't even exist 10 years ago. One of our participants is coming through via a technology that is just a technology just like that. So I think this obviously has a lot of implications for both population itself, but also how we research it. But I think it's an interesting moment, too, because there have been some concerns among people within population health about whether technology potentially distracts from some of these broader social determinants that we all care about. So if you've read recently about this term precision medicine, and some of the concerns and critiques raised about it, whether it'll just lead to an emphasis on individualized, hyper-tailored solutions, you know what I'm talking about. And I think that critique has some validity to it, but it also seems a little overly pessimistic to me. I think technology is what we make of it. We can take it in that narrow, hyper-individualistic direction, but we can also deploy it towards research, interventions, and actual products that work at a high population level, which we're all interested in. And I think that's what all three of these terrific scholars are doing, two in person, one joining us by Skype from the other coast. But it's also true that technology doesn't come with some pitfalls as well. There are privacy issues. There's a potential for a lot of collision between private interests, private companies, the private sector, where a lot of this research is actually done, and academic and research values. And one of our speakers is actually from a private firm. So we're going to possibly touch on that and some other concerns too. But you didn't come here to hear from me. You came to hear from them. So let's get this started. This is how it works. I'll introduce them really quickly in just a moment, and then in more detail as each one comes to speak. They'll all talk for about 15 to 20 minutes, and then we'll keep moving and do the Q&A at the very end. So I'm going to introduce them very quickly right now, just names and affiliations. First, we have on the far end of the table, Mike Bader from American University right here in Washington, D.C., and right next to him, coming from an epicenter of technological innovation, Silicon Valley, Olivier Humblet, who works at Propeller Health. And finally, Jen Stuber, is joining us right now via Skype from the other coast at the University of Washington. I also want to just acknowledge and give a hand to Colin Fink to my left for getting the Skype working and making sure all the visual accompaniments are going to go well. Let's give him a hand. There's a lot of work behind the scenes. So without further delay, Mike Bader, let me just talk about him very briefly. He's an assistant professor of sociology at American universities. He studies cities and is particularly focused on housing markets and their relationship to health. And more recently, and the reason he's here, he's been kind of coupling traditional survey method techniques with new large-scale big data sets. And today he's going to be talking about his work with Google Street View. So Mike Bader.